have been a number of challenges to the rollout of the programme in the implementation phase. I think it's always a challenge when you're working with new partners, because you have to build a relationship with them and you have to find win-wins in terms of expecting people to take on new work. We needed to be able to support them quite closely. I think both organisations, or all the organisations that worked on the project, have found challenges in different ways. The Lapwing Centre staff have been enthusiastic about the project, very enthusiastic, but perhaps less used to being proactive in terms of encouraging people to use the service, and we've had to give quite a lot of support to the Lapwing Centre staff in order to build their confidence to approach people. The Children's Centre went through a very big organisational change quite soon after we launched the initiative, which meant that the Lose the Fags work got lost really, as the Children's Centre management changed and there were a number of staff changes. And so really we had to start to build the relationship up again from the beginning, and that's bound to have had an impact on how well we could roll out the programme. The biggest challenge was keeping all the communication networks that we'd opened up going at the same time, and responding to each person's need within the programme in order that they could feel that they had something to contribute. I think reflecting on the challenge of social marketing as a approach as we experienced it in the Brinnington project is that it stretched our resources, because we were working on a multifaceted initiative to quite a rigid time scale, although that did slip, and it slipped because we had limited resources in which to bring together both a communication strategy, an infrastructure development, which were the new services, communication with the public and with other health professionals, ensuring that we had the support of the senior managers within the council and the NHS, plus making sure that the community were with us all the way in terms of the development of the initiative, in that they were involved in the focus groups, they were involved in the stakeholders group, they were involved in the modelling of the posters, and were involved in the launch of the initiative. I found that I was juggling many different interventions at the same time, pieces of the puzzle that needed bringing together, and I think that the challenge was to bring them together on a particular time and a particular date. In effect, what happened as a result was things did come on stream at different times. So although we did have a launch on a specific date, some of the interventions took a lot longer to bed in than the actual launch. So we had less of a sort of high impact, but more of a longer sort of incremental impact in the area.